Hello everybody. Today I'm going to discuss about crying baby under 3 months of age. Baby's cry can be upsetting and frustrating, and it is designed to, uh, get your attention, and you may be worried something wrong with your baby. Your baby may start to cry more frequently from 2 weeks of age, and crying may get more frequent and last longer during the first few weeks and hit the peak about 6 to 8 weeks of age. Every baby different, but after 8 weeks, babies start to cry less and less each week. Babies cry for many reasons. Most commonly, they are uncomfortable or unwell. This may be due to colic, maybe due to reflux, constipation, or infections are among commonest thing. So just as a carer, it is very distressing, and you have to know when you need to go emergency, or when you can discuss with GP, or when you can take care of your baby at home. So most important thing, the red signs that you have to look, that whether baby is pale, mottled, or abnormally cold to touch, or become very stiff for prolonged period, and maybe any jerky rhythmic movement of arm or legs that not stops even you hold them, that is called fit or seizure. Become extremely agitated, crying inconsolably despite distraction, or become floppy or very lethargic, difficult to awake, has blue lip and difficult breathing, a rash that does not disappear with pressure. We call glass test. You can press with a glass or on the skin, and you can test it. And in under 3 months, temperature of 38 degree or 38 degree centigrade or 100.4 degree Fahrenheit or above. So unless this fever is 48 hours following vaccination, then it is different. So you have to go to emergency department, and in UK you have to call 999. Now, if those signs are not there, but your baby is increasingly sleepy, not consistently awaking for feed, no wet nappy for 8 hours, has a dry mouth or sunken fontanelle, like if you give your hand on the top of your head, you can find a soft spot that is sunken or not, you can feel, and is getting worse, then, or you are worried, you can ring your GP in NHS, or you can call NHS 111 to get advice. Now, if your baby has none of this all sign, continues to feed well, has plenty of wet nappies, then you can take care of your baby at home. If you still concerned, of course, you can discuss with 111. Now, one of the cause of these crying babies is colic, that is excessive frequent crying of baby who appears otherwise healthy. It's common problem and affect 1 in 5 babies. Cause we don't know. Is likely due to intestinal discomfort like bowel cramping. It begins when baby is a few weeks old and normally stops when 4 months old, maximum 6 months. Now, what are the signs you think in the colic? Actually, suddenly baby will start crying, is very high pitched, nothing seems to help. Crying begins at the same time each day, often in the afternoon or evening. Baby may draw the legs up when they cry, might clench their hand, and face may be flushed. Crying can last for minutes or 2 hours. A baby with colic cries for 3 hours a day or sometime more. The crying often winds, winds down when baby's body is exhausted or when they have passed poo or wind. Now, what you can do to help your baby? Actually, that is very, very difficult to tell because every baby is different, and actually you can try different method to stop crying. Actually, baby can cry also different reason, like they can be hungry, they can be tired, they can be wet or dirty, or they can be unwell. Some simple technique you can try, like humming noise, talking calmly, sing to your baby, let them hear some soothing noise, hold them very close and skin to skin, go for walk outside your with your baby, give them a warm bath. But cannot tell that any of this technique will work. It is very, very difficult to tell. You have to use combination to soothe your baby. Now, if the crying is not stopping, what should you do? Not every baby is easy to calm, but that does not mean you are doing something wrong. So don't get angry with your baby or yourself. Instead, put the baby in a safe place and walk away. For that, you can calm yourself down by doing something that takes your mind off the crying. Doing some exercise or yoga can be relaxation exercises can helpful. Call your friends or relative, may be able to calm your baby. After a few minutes, when you calm, go back and check the baby is okay or not. It's normal for parents to get stress, especially by their when baby is crying. Put some time aside for yourself and take care of your needs as well as your babies to help you to cope. Handling a baby roughly will make them more upset. Shouting and getting angry with your baby make things worse. So for help and support, you can get a website called Icon website. You just check the parent advice for that. And this is written by healthcare professional, and you can get help from that. Hope these are the few tips that help about the crying baby. It's not an easy thing, but hope these tips will help you to understand a bit of it. We'll try to talk a little bit more about other topics next time. Bye for today.